Okay, today I'll be demonstrating how to start an IV and administer medication. So my order, the first thing I have to do is I will verify my official order of my medication record. So I have a Wanda Chi, date of birth 9/20/20 SX, no allergies, start IV now by 9 a.m. Mepridine 50 mg, slow IV push over 2 minutes now. So my medication record says Wanda Chi, date of birth 9/20/20 SX, start IV now by 9 a.m. Mepridine 50 mg, IV. Okay, so my medication record matches with my official orders. So I should go ahead and go to my medication room and they pull out my medication, and that will stand as for my first check. So I pull out my medication. This is my Mepridine. I don't know if you can see it. Okay, so let me check again. I have Mepridine. Okay. 50 mg is ordered. I have 100 mg, so I'll do my calculation, which I already done, and I'll be giving my patient 0.5 ml because I have 100 mg in 1 ml. Okay, the doctor ordered 50 mg, so 0.5 ml. So right medication, right route, right dose, right patient, and right time. So this complete my first check. So once I pull out my medication, I should go ahead and pull out my supplies. I have my alcohol prep, I have my saline flush, I have my syringes, I have my 2 IV. And it's imperative to know that I don't stick my patient more than 2 times. If I couldn't get it done in 2 times, I will let someone else try. Okay, I have my extension, catheter extension, I have my syringes, I have my IV starter key, I have my pad, and I have my tourniquet. So I already got my skinny tapes. I got a lot of them in my side of the table. So now I walk into the patient's room. Hello, my name is Anthony Aminos from Mountain View College. I am here today because the doctor ordered I start an IV on you and I administer Mepridine, which is a pain medication, to you. So can you verify your name and date of birth for me? Hey, my name is Wanda Chi. My date of birth is 9/20/20 SX. I said, okay. Do you have any allergies? No. Okay. Have you had an IV before? Yes. Okay. Do you have any problems with me starting the IV now? No. Okay. Do you have any pains? Yes. Can you rate your pain on a scale of 1 to 10? And my pain is 10. Okay. And where is it? Where you're hurting? My hip. Okay, Wandachi. I hope that once I start the IV and all that, the pain medication is gonna relieve your pains. Okay. Okay. So I will check the site of administration, which is in the arm, and I will make sure that there's no mastectomy, there's no IV shun, there's no skin breakdown or redness or bruises. So I'll make sure that the area I want to start the IV is good and look healthy before I start, and then I'll perform my hand hygiene, and then I'll put on my gloves. So I'll leave the patient bed to my waistline for easy maneuvering, and then I'll go ahead and first thing I'll do, prime my IV extension. So this is my IV extension. And make sure to maintain sterility while I'm touching my IV extension. This is my normal saline. Okay. Okay. I prime it You see the water coming, so that means there's no air bubble. I don't want to give my patient air embolism. Okay, once I'm done with priming, I should go ahead and get my tourniquet. So before then, I'll get my alcohol prep ready. Okay, can use this one. So I get my tourniquet. This is my patient arm, okay? I'll tie it in such a way that it will be easy to remove, and I'll make sure that I don't leave the tourniquet on for more than a minute in a patient at a time. So once I tie the tourniquet, I get this. I tie the tourniquet 3-4 inches above the site of sticking. Then I get my alcohol prep from in and out in a circular motion. I clean my side. I get my IV. Okay. The bevel up, looking at 15 degrees. I go ahead and hold it down. Let's stick. Until it is locked, and then I'll remove my tourniquet. Okay, so once I see the blood in the compartment, I'll know that I got the right vein. Then now I'll get my extension key. So this is something I have to do fast so that the blood don't have to splash anywhere. So I untwist it, getting it ready. And then holding the blue pad. Okay, now my IV is secure. Okay, so I'll go ahead and with my skinny tape, I'll do a butterfly to secure my line. They get another tape. Stay on the blue pad, and I make sure that I don't touch the site of insertion to avoid contaminating it. So once I'm done with it, I still have to go ahead and flush to 2 ml. Looking at the site under the patient, so it flush good. Once I'm done with my flushing, okay, I'll go ahead and get my medication ready. My medication for now. Okay, so now it's time for me to do my second check. So I have my mepridine, I have my right medication, I have my right dosage, and medication calculation. 0.5 ml, right time, right patient, right route. Okay, so I get my syringes, making sure that I maintain the sterility. Okay, I will draw a 0.5 air. Okay, so should go ahead and put it back. Okay, because I need to clean my I use alcohol prep. To clean my medication. Okay, now I'm ready. Dose 0.5 air. So I got my 0.5. You guys see my 0.5? Okay. Make sure there's no air bubble. No. Okay, got my medication 0.5 ml. And then it's time for administration. So I should go ahead and do my test check. So now I have my 0.5 ml. I have my right medication, of which I already checked the expiration date is good. I do my right route, which is an IV, which I'm about to do now. I do my right patient and right time. So after my third check, it's time to administer my medication. So I should go ahead and get another alcohol. So I should unscrew my saline. Screw my medication. Screw my saline. Then I clean it. Then I screw in my medication. Then slowly I make sure like 1 ml in 2 minutes. So as I'm pushing it in, I'm looking at the site and I'm looking at the patient, checking their tolerance. So once I'm done giving my medication, I will unscrew it with a new alcohol prep. I'll clean it. And I'll get my new normal saline. Screw it. But before I screw it, I make sure I reduce air bubbles. Okay, then screw it. Flush it with 2 ml of normal saline. Then I unscrew it. Clean it again with a brand new alcohol swab. Then at this time, I should go ahead and secure my IV. The tip. Okay, and after I've administered my medication, I'll get this. my Tegadan. Just to stick it up. So this is what I will use to secure the side of position. So I'm gonna put it. I know it will look cleaner if I'm doing it on someone's arm. This is so small. So then I will write my initial date and the gauge I used. So write my initials, and the gauge I used 22 gauge. Put it by the side. So now I'm done with everything. So I should go ahead and clear my table, put out the syringes in the sharp container box, and then I'll tell my patient this medication can make you feel dizzy or lightheadedness. So if you need help going to the restroom, just press the call light so that I will help you. I will bring the bed to the lowest position possible and make sure my patient is comfortable, and then I will ask her, is there anything else you want me to do for you right now? She'll be like, no. I'll be like, okay, I'll be back in 30 minutes to check your medication and tolerance, okay? Make sure everything is fine. Said okay, but if you need anything, just press the call light, okay? Said okay. So once I'm done with clearing my table, putting my patient in a comfortable position, lowering the bed down, then it's now time for my documentation. So go ahead and remove my hand glove before hygiene, and I will document that IV started in left arm with 22 gauge catheter and 1 stick and 50 mg mepridine administered. Patient tolerated well. IV site looks decent. Okay, so I will also write the medication I administered, the date, the time, and the patient reaction or tolerance to it. And then that's how you start an IV and administer medication. Thank you.